Yeah, my name is Yohana Mabirika Dotto. I'm going to present to you a validity of rapid serological Salmonella test in coexisting with Helicobacter Pylori infection. Yeah, introduction and the thesis. The validity of rapid serological Salmonella test is the ability of the test to measure the phenomenon that is intended to measure for the purpose of making true diagnosis of the infection, which help in clinical research during clinical trial and clinical practice to choose the right drug for trial as well as treatment. Salmonella type E have somatic or antigen, which are liposaccharides, and flagella H, which are protein. Both are used in preparation of diagnostic kit for serological rapid test for enteric fever. Salmonella type E has a unique biochemical character of producing trace amount of hydrogen sulfide as well as identifiable features of forming black interface on the slant and bat in Kia and TCI media. It is also biochemically negative in gas from glucose, fermentation of ductose semen, citrate, and ornithine the carboxylase coated from Wambura. The Helicobacter pylori are helical or spiral in shape gram-negative bacteria when examined microscopically motilely with multiple shaped flagella, hydrolyzed urea, and a positive biochemical reaction to catalase oxidase and urease, and can be isolated in blood agar media by forming small transient gray colonies. Diagnosis of H. pylori infection in patient with peptic ulcer in clinical practice can be done by use of serological rapid test. H. pylori strips to identify IgG antibody against H. pylori against in the serum and in the fecal material. Detection of the urease and the BAC gene is by use of PCR from gastric biopsy patients. From archival data obtained from Maranatha Private Health Laboratory, Ngudu, Mwanza, Tanzania, for 2015, 234 cases were tested for both widow and H. pylori tests. 29 cases were reactive for both widow and H. pylori. 69 cases were reactive for widow test only, and 2 were reactive for H. pylori only. 27 were tested negative for widow test, and 74 were negative for H. pylori from Maranatha. From these results, the validity of widow test in 29 reactive cases for both tests is uncertain. Problem statement and justification. The purpose of this study is to determine the validity of serological rapid widow test in diagnosis of typhoid fever in coexisting with Helicobacter pylori infection to ensure specific diagnosis of the disease, which will help in proper drug choice in clinical trial and practice. General objective: to determine the validity of serological rapid widow test in diagnosis of typhoid fever in coexisting with Helicobacter pylori infection. Specific objective: to evaluate the specificity of widow test in diagnosis of typhoid fever and to identify the presence of Salmonella type E and the Helicobacter pylori sample from patients with dull infection. Material and the methods. Area of the study. The study was performed in Tanzania, Mwanza Urban and the Kwimba district from selected health laboratory, performing a widow and a H. pylori test. Sekotura Regional Referral Hospital Laboratory, where a sample analysis was carried out. Methods and the material and the methods. The target population was all people with complaint of abdominal pain accompanied with fever who are found reactive for both widow test and the Helicobacter pylori one-step test. Stool sample from eligible patients were inoculated in reactive media and incubated in recommended environment. The maconche and the blood agar were prepared in sterile environment for culture Salmonella type E and the Helicobacter pylori respectively. From 567 respondents tested for serological rapid Salmonella type E and a Helicobacter pylori test, only 33 respondents, which is equal to 5.8%, were reactive to both tests. Their respective stool samples were collected for culture and identification for causative bacteria. 33 cases who were found reactive to both widow and a one-step H. pylori test, only 6, 18.2%, were recovered with Salmonella type E. And all 33, which is 100%, were recovered with Helicobacter pylori bacteria. This is the plate cell of blood agar with a colons recovered from stool after being inoculated at low oxygen. And this is also the test of oxidase to identify for presence of Helicobacter pylori. The pure colonies recovered from blood agar, as shown above, tested positive for oxidase strips in identification of Helicobacter pylori. And this is the large colony of maconche agar, where the stool is being inoculated for identification of one step, which is negative for H. pylori positive. TCI tubes showing inoculated recovered pure colons from maconche agar, identification of the Salmonella type E by producing hydrogen sulfide gas, acidic as a blank state at the butter, and alkaline at slant, as you see there. Conclusion and recommendation. From this study, it has been revealed that Salmonella enterica serotype type E and the Helicobacter pylori infection can coexist according to the nature of their occurrence. Incomplete investigation noted from clinicians leave their patients undiagnosed. Serological rapid Salmonella slide widow methods test in coexisting with H. pylori infection is less sensitive and invalid. According to this research, only 18.2% out of 33 samples tested positive for both widow and a one-step H. pylori test. The isolated S. type E bacteria after culture of stool sample shows that 27, which is 81.8%, were reactive due to H. pylori antibody interaction, while 33, 100% samples of H. pylori bacteria recovered after stool culture. This concludes that one-step H. pylori test is very reliable and specific in diagnosis of H. pylori infection, even in coexisting of infection with Salmonella type E. Recommendation. From these findings, I do recommend all cases that come with abdominal pain associated with fever and general body weakness should be investigated for both S. type E and H. pylori. All suspected cases of typhoid fever should be diagnosed by culture of stool, blood, urine. Further studies should be suggested to rule out what is specifically causing reactivity of widow test in presence of H. pylori infection. The end. Thank you, all of you.